Thank you, Madam Deputy Speaker. There is clear evidence that deprivation has a big impact on health and life expectancy. Preventing disease and encouraging healthy lifestyles are the key drivers in reducing poor health and early deaths in all communities, but particularly in more deprived areas. So much is known now that wasn't understood in previous generations about the importance of exercise, maintaining a healthy weight, stopping smoking, eating fruit and vegetables. We may know what we need to do to give ourselves the best chance of staying healthy, but there are many barriers that prevent us making these choices. And these barriers are far higher for people living in more deprived areas. Low household income is a barrier to good health. If you're struggling to make ends meet, making sure you eat your 5 a day and exercise 3 times a week is not an urgent priority, or perhaps even affordable. That's why this government's commitment to raising the national living wage is so important, but we know there's more to do. A second barrier to good health is infrastructure. For many of my constituents in the rural villages around Penistone and Stocksbridge, it can take a whole day to travel to and from a hospital appointment in Sheffield because bus services are so few and far between. And this government's commitments to improving buses are vital for people who rely on public transport to get to healthcare services. Another barrier to good health is the lack of information, and increasingly health and medical information is going online. So we therefore must tackle inequalities in digital skills and access. There is much that this government and our fantastic NHS is doing to tackle health inequalities, but there's also an important role for our families and communities in helping people to get and stay healthy. Community groups are vital in giving people hands-on and practical health advice and supporting us towards healthy lifestyles. In my own constituency, we have the Uterbridge Stride Out Running Club, which has helped many of my friends from the couch to 5K, although I'm afraid I'm still at the couch end of that. We also have Stocksbridge Leisure Centre, run by and for the community and pioneering social prescribing. As human beings, we don't exist in isolation, but in relationship with those around us. Relationships with our families, friends and communities are so important, and they're often our first port of call when we have health concerns. Breastfeeding support is a brilliant example of this. There's clear evidence that being breastfed improves your chance of being healthy. But, and I say this from lengthy experience, breastfeeding can be tough, and new mums need support from friends, family and community to keep going. And I was lucky enough to have support from fantastic community groups when I had my first child, but I couldn't have kept going without that. Levelling up our left-behind areas isn't just about better buses and trains, it's about investing in communities. We need to make every effort to reduce health inequalities by funding our NHS, raising incomes, improving infrastructure and helping people access information. But we must recognise the importance of family, friends and community to our health, and so I welcome our manifesto commitments to a programme of strengthening families and championing family hubs.